Some of our students struggle in the classroom comprehending concepts. Some of our students struggle with taking an exam, specifically nursing exams. What are some key steps that we can follow to make sure we've done our part as a nurse educator and aligned with the recommendations from NLN about nurse educator competencies to best evaluate and assess whether or not learning has happened within the classroom? In these several next snapshots, that's exactly what we'll be exploring. What are those key elements in the exam analysis process that we want to make sure that we have competency about? And then, second of all, what are we going to do with that information once we figure out which areas students are struggling in? And second of all, what are some of the key specific learning that we need to do to make sure we are creating the most valid and reliable exam? Welcome back, everybody, to Dr. Sellars Educate. If this is the first time you're tuning in, welcome. We're delighted that you're here. Make sure you go ahead and print out the study worksheet that's listed right here in the description. This is going to help you stay focused as you move forward on your journey. Now, some of you may be here just to hone in on your nurse educator skills, and that's great because we know more than 70% of colleagues report that exam analysis is a muddy point for them. All right, so we're going to start in our session today in this series talking specifically about discrimination index. So go ahead on your study worksheet and write down today's date, whatever date you're watching this snapshot, and make sure you subscribe to our channel so every single time there's a new one released, you'll be notified right away. So we're going to look at discrimination index in this snapshot, and then we're going to continue over the next several sessions in exploring which key elements do you want to hone in on and why is that data so important. So, discrimination index, let's start there. We're talking about how do we truly discriminate our high scoring students' knowledge from our low scoring students' knowledge. Our goal is that all of our students will score well on the exams, right? That makes us all happy because this is a way for us to validate that learning has happened. But what we know about discrimination index is that it is a critical metric when we are evaluating whether or not students have grasped the knowledge of these concepts that we expected them to. It tells us whether or not there are muddy points or if there's a strong level of clarity related to these concepts. The discrimination index is a quantifiable measure. Okay, so we're going to talk about how that's measured. And then I want you to go ahead also and turn over in Billings and Halstead if you have your textbook with you, which we highly encourage you bring it to every one of our snapshots or any content that you're joining us to review. So this is going to be chapter 25 in the 6th edition. We are still in the 6th edition because that is the one currently used by NLN to write the exam questions. Okay, so discrimination index. We're differentiating between exactly what it says, discriminating between those students that are knowledgeable about content and those students that are not. The first step, though, before we even write one exam question, is to develop our exam blueprint. Okay, you're going to find an example, a couple of examples in your textbook. We want to make sure we create that exam blueprint as a first step because it is really our roadmap. When we think about what content we want to validate that students have learned on our exams, we've got to identify the objective, we've got to identify the level, and we should map it to the actual content that we have included in the class. So that's essentially what discrimination index is. It helps us really discern and really validate that learning has happened and be able to separate those students that are knowledgeable about content and students that are not. So why is it important? Well, it's essential because we want to validate that learning has happened before students are engaging in direct patient care. Exams allow us to help students see what it is that they're still not knowledgeable about. Our goal is that we're able to engage in formative assessments so that students receive this feedback on an ongoing basis, right? And then when they get to the exam, those exams, especially those final exams, are hopefully just summative feedback to our students. Hopefully they've done the work throughout the course with the formative feedback. They have studied, they have gathered data about concepts that may be a muddy point for them. They've engaged with us during our office hours to make sure that they have clarified any concepts that they're not clear about. So that is our goal. We rely on these assessments to tell the story about whether or not learning has happened. So, how do we evaluate? Well, there are key elements that we want to break down as it relates to our ability to evaluate exam questions effectiveness. We want to make sure that they have accurately told a story about students' knowledge. So, first of all, we want to be able to calculate that discrimination index. We're looking at that for our incorrect options. And for some of you, you may even have a discrimination index for the correct options. Some data analysis, exam analysis reports report that as the point by zero index for those correct options. And then for the incorrect option, they may report it as discrimination index. Okay. So just remember that. We want to check the scores. Make sure that the calculation is correct. And if there's any question about it, I would encourage you to contact whoever your resource is within your nursing program. If you have any questions about whether or not that data is valid, we want to look at how we're teaching and what are we teaching, right? Going back to that blueprint, we've mapped content to each of those questions on the exam blueprint. We know when we have taught that content, at least within that 4-week window, hopefully. We know, as an example, when we taught students about heart failure. We know when we have explored the respiratory system, the GI system. So our goal is that within that 4-week window, as an example, if we have taught cardiac, then we're not going to include questions about respiratory unless it is a comprehensive exam, right? We want to make sure that we are engaging in content review within that window of time when students are going to be evaluated. There's a term called deliberate practice theory. It says that our ability to truly teach students content related to concepts within that specific time frame, we want it to be short, right? We want to teach students about heart failure in the cardiac system. We want to reinforce, we want to validate that learning through quizzes or through other formative feedback. And then we want to create a summative evaluation tool so that we can validate that learning has happened, or letting the students know that, you know what, you didn't quite get these concepts. So we want to make sure that we provide some remediation with them, some additional resources and support so that they can clarify those concepts. These are all steps in the process that help students develop that clinical judgment that we really need them to hone in on and be able to make those safe patient care decisions. As always, we want to look at opportunities to improve the quality of our exams, to create more valid measures so that we can feel confident in the results that we see on the exams. We can feel more confident as to whether or not students are comprehending these concepts, and then we can plan for additional resources or additional content review with our students. When we talk about evaluation, we are talking in these several series about exam analysis specifically, okay? But we know there are other ways that we evaluate whether or not learning has happened, and we'll cover that in a future series. So what are these steps that we're talking about? Well, we use the discrimination index as one measure to accurately reflect whether or not students have an understanding of the material. It's a process that we want to really help us validate the quality of the exam that we have developed, that we have administered to our students. And this is why it's so important when we're looking at that exam analysis to consider a peer also looking at that data, right? We want to gather feedback from our colleagues that may have a different perspective about that exam, may have a different perspective and experience level related to exam analysis. So we want to engage and collaborate with our colleagues to help validate whether or not this data is really accurate and to help us determine what are our next steps. All right, so now let's talk about how do we identify our high and low performers. Well, hopefully it's not a surprise, right? When we get to the exam, hopefully we've already identified some students that may be struggling in our class, and we have engaged with them, we've helped them, we've guided them about resources that they should use to help them close their knowledge gaps. And then next, we want to think about how do we calculate it? Well, there is a calculation. We know there's a statistical analysis, but thankfully, this data is calculated for us, right? But this is just FYI as you're moving forward and better understanding the exam analysis process. And then next, we want to talk about how do we interpret it? What does that number mean? Thinking about the C&E exam, you want to consider 3 elements. Number 1 is going to be the definition. So what is the definition of discrimination index? And then number 2, what is the range, the actual range of discrimination index, and what does it mean? And then that third element is that qualitative component. So now that I've gathered this data, what am I going to do with the information that I have? All right, so this tells us that scores above 0.3 are considered excellent, while those below 0.1 indicate that those questions are ineffective and may require revision. A thorough analysis is going to help us really refine our assessments to better evaluate students' knowledge and skills in order for us to validate that learning has actually happened. When we look at our options, we are assessing whether or not our correct option and our incorrect options are effective. Now, when we talk about discrimination, oftentimes we mention also the distractor index. Okay, so point by zero index, discrimination index, you may see those used interchangeably. Some exam analysis reports may only use one or the other, but don't let that distract you. Okay, just focus on the fact that when we're trying to discriminate between our high scoring and low scoring students, we are in essence seeking to validate whether or not learning has happened. And when we get to those distractors, those incorrect options, we also want to validate whether or not they were effective. Okay, so we can use PBI or DI, and then some tools you may see it called an actual distractor index. Okay, so just keep that in mind. All right, so now we want to talk about the effectiveness. This is crucial too when we talk about the incorrect options and the options. We know that when we have an ineffective distractor, then students are able to guess the correct option more often. Okay, so we're going to talk about that. Write that down if it's a muddy point. When we are exploring the distractor effectiveness, if it is a distractor index of 0, it's going to indicate that students have an increased likelihood of guessing the correct answer, right? Because with the distractor incorrect option, we are not able to attract that student who's not knowledgeable about the content, right? Because it's 0. A distractor index of 0 is going to tell us that it wasn't selected by anyone. Okay, so that's just one example. When we talk about options, that includes all of them. And for purposes of the C&E exam, right now there are 3 options. There's 1 correct one and 2 incorrect one. Okay, so 2 incorrect ones. So you want to make sure when you're thinking about developing content for your exam questions for your students, we know that with the next gen process, there's a lot of different options now. It's not just multiple choice, but the good news for the C&E, you still will have multiple choice questions and you will have 3 options. We want to be able to analyze whether or not the options were effective. We're analyzing both the incorrect and the correct ones. Okay, so a high selection rate for correct options indicate clarity, right? Because what that means is for our students that are not as knowledgeable, remember our goal is to separate the two. That's what we want to validate on the exam. So if our high scoring students are choosing the correct option more often, that's a good thing. That means that we're able to validate that learning has happened. If our high scoring students are choosing the incorrect option more often, then that's going to trigger that we need more clarity around those concepts. And we also want to engage in that qualitative element where we're going to the students, we're engaging in that exam review, and we're really discerning for ourselves what those muddy points are. Yes, we're gathering feedback from our students, but we can pick up on those visual cues, right, when they have that deer in the headlights look. We want to identify those misleading options. So if we have used certain jargon as it relates to those options, right, that can be a distractor. If we have ambiguous phrasing, if we're using slang words, right, those can all be very misleading. So we want to avoid using any of those types of strategies when we're writing questions. We want to engage in learning how to write valid and reliable, or we want to be able to write questions that lead to valid and reliable exams. We want to adjust questions based on our analysis. This is part of our exam review process, right? We want to consider changing those misleading options, rephrasing those ambiguous choices, knowing that we're gathering data from our students as they are moving forward with taking their exams. So in conclusion, we know discrimination index is essential. So as we wrap up, let's take a look at our thought-provoking question and see what you think. So in analyzing exam options, what is the most important characteristic of an effective distractor. So we have A, it is selected equally by high and low scoring students. B, it is frequently selected by low performing students. Or C, it is rarely selected by any students. All right, so go ahead and write down on your study worksheet which answer you think is the best option. Remember, when you're going through these thought-provoking questions, we don't want you to stress out if you don't choose the correct option. It's most important that you understand the rationale for the correct option and the incorrect option. All right, so if you chose B, you are correct. Okay, the correct answer is B. It is frequently selected by low performing students. Now let's talk about the rationale. Okay, so A says it is selected equally by high and low scoring students. We know that our goal in discriminating between high and low students is exactly that. We want to effectively attract those students that are not knowledgeable to the distractor, right? And the discrimination index tells us that there is a separation with our distractors and with our correct option. Okay, so all options, we want there to be a discrimination between our high scoring and low scoring students. So the most important characteristic of an effective distractor is that there is discrimination, right, between the two. We don't want them to be equal. And then C, it is rarely selected by any students. Well, that doesn't really answer the question, and that response is not aligned with what the question is asking, right? Which is, what is the most important characteristic of an effective distractor? We want you to also think about, as you move forward on your journey, what are your gaps? So take a look at the blueprint, the detailed exam blueprint. There is one for all 3 exams in the handbook, the NLN handbook. You want to do a self-assessment of where you are as it relates to concepts for each of these areas. And then our last content really is looking at encouraging continuous improvement. Discrimination index is just the first measure that we're looking at on this journey, where we're breaking down these concepts in a way that's more practical. We're giving some examples, some scenarios that hopefully will help connect the dots for you, realizing that this is a role of nurse educators to continuously explore our gaps, to reach out to colleagues, reach out to experts to help us along the way. We hope that this snapshot has been helpful as you think about what are your gaps that you have right now as it relates to exam analysis, and what are your next steps to help you bridge those theory practice gaps, and most importantly, what support do you need to help ensure that you have the resources that are available and align with evidence-based practices so that you can move forward achieving nurse educator excellence with ease and also achieving success on the CNE exam. Reach out to us if you have questions, info@drsellarseducate.com. We look forward to seeing you next time. Have a great one, everybody.